Hello, this is Jung Yun Jang. Today's topic is analysis of eating disorders in Korean ballet dancers. The sequence of progress is as follows: introduction, method, result, discussion, and conclusion. The dancers use their body movement to convey artistic expression and message in the restricted of stage on the stage. Their physical appearance is a very important means of delivering a message to the audience and constant weight management for an ideal body shape. The ideal body shape recognized by dancers is that they prefer a lean body shape even though they are underweight. In particular, the frequency of mental stress and eating disorder was high in dancers, not only in preparation for performance or auditions, but also in their daily life as they continued to control their weight with the stereotype of their body image. Recently, eating disorders in dancers study, it was investigated that female dancers continue to internationally lose weight due to their subjective body dysfunctions regardless of objective weight perception. An eating disorder is a psychological disorder that has serious medical and physical consequences and can lead to death. Associated with serious psychological and behavioral disorder. It is divided into neuroscience nervous and bulimia nervous. Anorexia nervous is a severe distortion of one's body image along with extreme fasting. In bulimia nervous, repeated binge eating followed by artificial bloating and inappropriate compensatory behavior. Eating disorders with various risk factors occur mainly in women, and the incidence rate is higher in young people than in the elderly. Previous study here is. Previous studies have shown that dissatisfaction with the body, such as body shape and weight, and the degree of self-evaluation according to the body are factors that can directly explain abnormal behavior. While large epidemiologic studies generally estimate the prevalence of anorexia nervosa to be around 0.28% in young women. Other studies, the prevalence of anorexia nervosa in girl ballet dancers range from 1.6% to 7.0%. All of the dancers spend countless hours practicing in front of a mirror. The higher level of perfectionism they apply to the dance and the body, the social culture pressure on the stimulus. The dancer create a social and environmental atmosphere for the development of the eating disorder. Dancers tend to have a high frequency of eating disorder due to stereotypes about their physical image and the excessive stress to maintain them in their daily lives, as well as practice, auditions, and performance. Currently, there are insufficient studies of the risk prevention alternative of eating disorder related on professional dancer. Therefore, further research is needed to better prevent, diagnose, and treat this issue for dance. Previous research has found that students studying at competitive ballet schools score significantly higher on the eating aptitude test and had a higher prevalence of anorexia nervosa. Compared to BMI, the frequency of eating disorders was found to be higher in the group who evaluated their own weight higher than their actual weight. Therefore, it suggested that BMI is an important variable to explain eating disorder. Also, BMI is the most widely used method to determine obesity worldwide by calculating the ratio of height and weight. Past research has shown that female ballet students weigh significantly less than non-dancing high school students. And unusually low weight is considered more normal. Furthermore, female students are less satisfied with their weight than non-dancing girls, and they often want to lose weight despite a low body mass index. The eating aptitude test presents a variety of symptoms of eating disorders in both patients with anorexia nervosa and high-risk models and groups of dancers. The anorexia patients score higher than dancer groups in all areas of psychological symptoms. Nevertheless, there was a significant positive relationship between various psychological symptoms and high EAT score within the dance group. So, according to the result of previous study, the higher the body mass index, the higher anxiety and dissatisfaction with the weight of the dancers, and the risk of weight loss and obsessive thought about eating disorder increased. This risk is considered lower than in anorexia nervosa patients and higher than in general students. However, there were no studies examining the relationships between student dancers and their eating attitude. Therefore, it is necessary to examine the effect of age, height, weight, BMI, and eating attitude, which can be important determinant of eating disorder in Korean female dance. This study proposal of The proposal of this present study was to investigate the frequency of EAT and BMI in classical ballet dancers and to identify the difference in BMI, eating attitude, and general variable for ballet students. Here is method. The participants in this study were 317 female dancers, and their age were 17 and 32 years. Their average age is 19.53. The participants were divided into two groups. Group 1 consisted of high school ballet students, and the other group 2 is a college and university dance classes student. To the investigation established in this study, the EAT questionnaire was used, and the basic information, age, education, experience of ballet, height, weight of the participants was collected. EAT, eating problems were assessed using a Korean version of the EAT 26, a version of the 26-item eating aptitude test. According to the Garner and colleagues, three factors have been identified in the EAT 26. First, avoidance of fattening food preoccupation is diet, 13 items. Bulimia and food preoccupation is bulimia, 6 items. Personal and social control of eating behavior is oral control, 7 items. This version answered on a 6-point Likert scale ranging from 0 to 5. The internal consistency and the test reliability of Korean version of EAT 26 were found to be good in a previous study. Also, in this study was good international consistency. As a criterion for scoring anorexic nervous or widely recognized the cutoff point score of the EAT, as well as a low body mass index, was adopted. Also, we measured BMI. A participant's body mass index is calculated as weight divided height to determine the frequency of female ballet dancer in the category proposed by the World Health Organization. Procedures. The administrative approval of this research protocol was approved by the research community of the Korean Research Foundation. After obtaining permission from the high school and university official and high school parents, the researcher was visit the school in person and began the investigation. The researcher explained the purpose of this study, and all data were anonymous and confidential, and a survey was conducted on voluntary participation. Then, informed consent was obtained via email from both high school students, their parents, and college and university students for an online survey. A questionnaire was measured during class for students who attended school on the day of the survey by the teacher in charge of students who were willing to participate. They were also asked to provide their current body height and weight measures in class. The collected data were computerized using the SPSS 20 program according to the purpose of the study, except for questionnaires that were judged to be doubly responsive omissions or insincere response. The specific method is as follows. First, the dancer body mass index was calculated as body weight divided height. Additionally, to assess the presence of risk for eating disorders, dance students were classified as positive for the presence of anorexic nervous when they scored a score of 20 or higher. A positive AN score was considered indicative of an eating disorder risk. Second, the Pearce correlation analysis was performed to examine the relationships between height, weight, BMI, age, and EAT. All statistical significance level was set up 0.05. The result The characteristics of participants in this study: 317 female dancers between 17 and 32 years of age. The specifics of these results are presented in this table. Compared to the students of high school and colleges, had a lower proportion of high school students than college students. Overall, a clear majority of the sample had underweight. 56 students were normal weight and the remaining 6 students were overweight. According to the suggested by the questionnaire, dancers were positive for abnormal eating behavior when the score above 20 was obtained, and negative for normal eating behavior when the score under 20 was gained. Through the result of EAT, in high school dancers, 19.6% had an eating attitude test score above 20, and 8.4% had an EAT score lower 20. Whereas in college and university dancers, 18.8% were EAT score above 20 and 81.2% were on EAT score lower 20. The correlation between demographics of height, weight, BMI, and score on measures of EAT and age in dance students are provided in table here. There was strong correlation for the height BMI, weight BMI. There was negatively correlation on the height and dieting of EAT. There are weak positive correlation for the age and weight and BMIs. EAT of bulimia in dance students only related significantly to the age, and there is no significantly dieting and oral control of EAT with age. This is discussion. The purpose of this study is to investigate the frequency of eating attitude and BMI in Korean ballet student dancing. This study focused on female ballet dancers because there were very few male students in the dance class. In addition to the above mentioned, the female dancers have a higher risk of eating disorders than male. The incidence of eating disorders in the study among Korean female dancers was lower than female ballet dancers in the United States. On the other hand, the risk eating of disorder for Korean female dancers was higher than male and female athletes in Norwegian. The classificatory analysis of the EAT-26 revealed that 19.6% of the high school dancers and 18.8% of the college dancers tested positive for AN symptoms. Although the eating attitude of the age group was lower than dancers from other countries, it is a very common phenomenon among women who are restricting eating to lose weight. Moreover, this may suggest that there is actually a great danger. Most studies on female dancers show that the strategic use for weight loss is higher in women than in men, and younger than in the elderly. In general, women are under more cultural and social pressure for a thin body, which may increase the hazard of eating disorder. The average BMI is in this study was 15.28 and 6.73, which is similar to the result of athletic sports player and ballet dancer, who had a lower than those mentioned in study of young athletes and dancers in other countries. Also, 32% of the dancers were underweight, and only 22% of the students were underweight, and only 5% were overweight. So in this result of BMI, 42% of high school dancers were found to be underweight in 38% of college students, and their overweight distribution was only 0.6% and 1.3%. According to this study, there is an inappropriate relationship between weight and height by analysis of anthropometric measurements collected by most dancers, and the results of this study are similar to those of aesthetic athletes or classical ballet dancers. However, looking at the figures presented in the result, they were lower than those presented in other studies and lower than those of general students. The BMI index of a female dancer had a positive effect on bulimia and oral control of eating attitude, but it was not related to diary of eating attitude. There was a lower positive correlation between age of dancer students and BMI. In dancer students, the EAT of bulimia had a significant relationship with age, but no significant relationship with dieting and oral control appeared. Professional dancers of all ages, regardless of gender, can essentially be a group at risk of eating disorder. In addition, the relation of eating disorders was higher than expected in women and men over 40 years age in Australia, and the author emphasizes the importance of further study in this group. This research was investigated the relationships between frequency of eating attitude, BMI, and age in Korean female dancers. Although this study was not confirmed the fact of eating disorders, it is found the dieting and bulimia of eating AT in female dance. It is found that the frequency of eating attitude in Korean female dancers was higher than in other countries, which seems to be related to the physical requirements of professional dancers. Classical ballerinas should perform a complex and highly technical movements like athletes. They must be prepared by trained, and rehabilitated as one, respected the specific given to them for performance. Furthermore, it seems that it is necessary to provide the informed and program-based various strategies, including medical, psychological assistance, and preventive measures in order to dance, could correct awareness and eating disorder and attitude. Thank you.